We've been hearing a lot about masks lately. Surgical masks and N95 respirators must be kept for healthcare workers and first responders. But what about homemade non-medical masks for the general public? The Center for Disease Control and Prevention recommends using cloth face coverings made from common household items in areas where social distancing can be difficult, such as grocery stores, pharmacies, etc. A non-medical mask is not proven to protect the individual who is wearing it, but it may help reduce transmission to the individuals around you if you have COVID-19. Keep in mind that some people do not show any symptoms, so they might have the virus and not know it. Wearing a mask is an additional method to protect those around you. It does not replace other measures. It's essential to wash your hands with warm water and soap, maintain social distancing, and avoid touching your face even when you're wearing a mask. Face coverings should be made with at least 2 layers of fabric and elastics for the ears or ties to tie behind the back of the head. The Canadian government recommends tightly woven fabrics such as cotton or linen, and the Centre for Disease Control and Prevention recommends cotton. Avoid using non-breathable fabrics. You can add a filter pocket to insert a paper towel for an additional layer. Using different colors and patterns on the front and the back of the mask is ideal to distinguish the two sides. Both of these websites provide tutorials for sew and no-sew masks. The mask should cover your nose and mouth completely and fit securely and comfortably on the sides of your face with no gaps. Make sure that you can breathe easily. When putting on your mask, wash your hands for 20 seconds with warm water and soap before and after you put it on. Keep your hair away from your face and place the clean mask to cover your nose and mouth completely. Adjust the elastics or ties as needed to ensure a secure and comfortable fit on your cheeks. When wearing your mask, it's important to avoid touching your face or your mask. If you happen to do so, wash your hands with warm water and soap for 20 seconds immediately. Maintain social distancing and wash your hands frequently. Remember to change your mask if it becomes damp or soiled. When taking off your mask, wash your hands for 20 seconds with warm water and soap before and after removing it. Take it off using the elastics or the ties and avoid touching the fabric. Use caution to avoid touching your nose, your mouth, and your eyes. You can place your mask in a sealed plastic bag if you are outside of your home. Remember to wash your mask after every use or when soiled. You can put it directly in the washing machine and wash it with other items on a hot cycle with a mild detergent. Dry your mask completely in the dryer and stow it in a clean bag or container. The mask should not lose its shape after being washed and dried. Don't forget that homemade masks are not the same as surgical masks or as N95 respirators. They have certain limitations and must be used with caution. Breathing may be more difficult and they are not as effective against virus particles due to the materials used and the looser fit, but they can offer a layer of protection and reduce the spread of respiratory droplets when worn correctly. You should not share your mask with other people. Masks are not recommended for anyone under 2 years of age, anyone with breathing issues, or anyone who cannot remove the mask on their own. This information comes from the Centre for Disease Control and Prevention and the Canadian government website.